Swayam Prabha. Digital India. Educated India.
Welcome to the course Therapeutic Nutrition. This is the fifth module, that is Nutritional Management of Non-Communicable Diseases. This is the seventh lecture of this module and we shall be studying about nutritional management of hypertension. I am Dr. Jaspreet Kaur, presently working as Assistant Professor in Government College for Girls, Ludhiana, Punjab, affiliated to Punjab University, Chandigarh. And this project is funded by DTH Swayamprabha, MHRD, New Delhi. In the previous lecture, we had studied about hypertension, and in which we studied what is the prevalence, what are the risk factors associated with hypertension, and what are the clinical symptoms along with complications of hypertension. And then we also studied about how to diagnose hypertension. In this lecture, we shall be studying about dietary modifications and various lifestyle modifications which are recommended during hypertension. So let us see what are the macronutrient needs during hypertension. We know excess calories through fat and carbohydrate, they should be reduced so that the weight is maintained. For a sedentary worker, we would recommend that 20 kilocalorie per kilogram of ideal body weight, that is the amount of calories he should be taking. If the person is moderately active, then ideal body weight, 25 kilocalorie per kg ideal body weight, that is a right choice. So coming to protein, normal protein contributing 15 to 20% of the total energy needs, they are recommended. But red meat and egg yolk, they are to be avoided because though they are rich sources of protein, but they have greater proportion of saturated fatty acids. So if we see, let us consolidate approximately 60 gram of protein that is necessary for proper nutrition in this condition. When we talk about fats, the persons who are hypertensive, they are more prone to atherosclerosis also. So it is advisable to avoid high intake of animal or trans fats. And the fats which are incorporated in the diet, they should be rich in unsaturated fatty acids. And they should not provide more than 20% of the total energy which a person is consuming. So here what we advise that a person should go for 20 grams of vegetable oil, and omega-3 fatty acids, they may actually play a very good role in regulation of blood pressure, because certain studies, they have indicated that they can actually help in dilation of the arteries. Coming to carbohydrates, approximately 60 to 65% energy that should be provided from the carbohydrates, which are polysaccharides, and they should be preferred over the simple sugars. Let's talk about minerals and electrolytes. Intake of minerals and electrolytes, it is actually closely associated with the maintenance of blood volume, because hypervolemia, it can cause greater pressure in the arteries. So that is why mineral and electrolytes, they are very important. When we talk about hypertension, there are certain minerals and electrolytes which are of great importance. They are calcium, sodium and potassium. So let us discuss the role of these minerals and electrolytes. Adequate calcium intake, it is an essential part of the treatment. And this can be ensured through intake of milk and milk products and green leafy vegetables, and a person can take plenty of cereals and pulses. So let us see what is the role of potassium. Dietary potassium and blood pressure, they are inversely related. Whenever high potassium intake is there, the blood pressure that goes down. And therefore, whenever there is decrease in potassium, that will lead to sodium retention by the body. And whenever there is increase in potassium, that will lead to sodium excretion. So potassium level has to be taken care of, and the high level of potassium, that will actually help a hypertensive to get a better control. So the sources of potassium are fresh fruits and such as plain unsalted nuts, and then fresh fruits just like apricots, sapota, banana, and citrus juices, leafy vegetables, potato, tomato, or legumes. They are good sources of potassium. Here, it is important to mention that natural sources of potassium, they are preferred, and pharmacological potassium supplements, they are not recommended because they may have certain kind of side effects. Fiber consumption, it has positive impact on hypertension. Now, when we talk about fiber, it includes both soluble sources of fiber and insoluble sources of fiber. And it will not only help in controlling weight, and it will be beneficial for only obesity management, but it will also help in managing the blood sugar levels. It will be helpful in the cardiovascular diseases. So both type of fibers, they should be included by a hypertensive person. So when we talk about fluids, fluid restriction is necessary only when the person is having certain issues where edema has happened. That means water retention is happening. And in many of the people, dehydration, it could be observed because they are taking diuretics. These are the diuretics are the drugs which are given to flush out extra water from the body, which is usually prescribed to the hypertensives. So in that case, normal amount of fluids, especially in the form of plain drinking water, they are recommended. Now, let us talk about a main major mineral, that is sodium. Sodium restriction along with the weight reduction, it is effective in controlling mild to moderate hypertension. That is when we are recommending 1 to 2 gram of sodium per day. So depending upon the severity of hypertension, different level of sodium intake, it can be recommended. So let us talk about various levels of sodium restriction. So the first level is mild sodium restriction, which is commonly followed. That is when we recommend 2 to 3 gram of sodium. In this kind of restriction, salt may be used lightly in the cooking, but no table salt is allowed. And a person is suggested to avoid high salty foods such as chips or nuts which are salted, or ketchup or processed cheese or salted butter, etc. And second level of restriction is moderate sodium restriction. Here 1 gram sodium is allowed. No salt is allowed during the cooking, and vegetable with high sodium content, they are limited. And along with that, mayonnaise, salad dressing, and bakery items where the baking powder or baking soda, it has been added, all these things, they are to be restricted in moderate sodium restriction. So the third level is strict sodium restriction. This is again a very tough thing. Here we have to restrict certain sources, food sources, which contain high sodium level, such as meat, egg, and milk. They are taken in smaller portion. Say in this condition, milk is restricted to 2 cups in a day, and the person can go for 1 egg, or if he's a meat taking person, non-vegetarian person, then 80 gram meat is restricted. He cannot go beyond that because that will raise the sodium level in the blood, and hypertension will be affected. And the fourth category is severe sodium restriction. This is a non-realistic kind of a restriction, and it is rarely used. Here 0.25 gram sodium is allowed, and further restrictions of the sodium rich food items, they are um, uh, given in this condition. So let us learn about salt and sodium conversion. So first thing to remember is milligram of sodium into 25 is equal to milligram of salt. So, for example, if I talk about a person who is having 2 gram sodium, that means he is recommended 2 gram sodium, that means 2000 milligram of sodium. I wish to see how much salt can be given. So, what I will do, milligram of sodium is 2000 milligram of sodium, and I am multiplying it with 2.5. What I get is 5000 milligram of salt. That means the person can take 5 grams of salt. But conversely, if I wish to see, I know this is the milligram of salt I have. I will multiply it by 0.40 to know how much sodium is there. So let us say if a person says I am taking 1 gram, 5 grams of salt, how much sodium am I getting? So 5 grams salt is equal to 5000 milligram of salt, that the equation says multiplied by 0.40. So what I get? 2000 milligram of sodium. So this type of conversion, they can actually help us in calculating whether the diet is fitting as per our diet recommendation. Dietary approaches to stop hypertension. So this approach is known as DASH diet. So what is this DASH diet? It recommends that a person takes low-fat dairy, he takes fruits and vegetables in larger amount, and he takes lower level of fats, he takes lesser sweets and red meat. And it is recommended that if a person follows DASH diet along with giving due attention to the weight reduction, his systolic blood pressure level will fall. So let us see, this is a table which tells that how many number of DASH diet servings a person can take when he is taking either 1600 or 2000 calories or 2600 calories, which will be recommended on the basis of the weight of the person. So let us see, these are the food groups which are mentioned, and these are the number of calories. As I have already told, they will be based on the weight status, and if a person wishes to lose weight, he may go for fewer calories. And this is the typical serving size of each food group. So let us see how this table has been created. So for coming to the grains, if a person is on 1600 kilocalorie diet, he should go for 6 servings of grain, 4 servings of vegetables, 4 servings of fruits, 2 servings of dairy, 1 serving of meat, poultry or fish, and half serving of nuts, legumes, pulses and seeds, 1 serving of fats and oil, and along with that he can take 4 to 5 servings of sweets in 1 week. So what is a serving size? If we are talking about six servings of grain, so 1 serving would be half cup cooked rice or 1 slice of bread. So that means a person can take around equivalent to 6 slices of bread. So coming to the vegetables, he can take 4 servings. So how much is 1 serving? That is 1 cup salad or half cup cooked vegetables. If we talk about fruits, the person can take 1 medium fruit, 3 to 4 1 cup of cut fruit, or he can, for coming to the dairy, 1 cup yogurt or milk or 45 gram of cheese, that will make 1 serving. When we talk about meat, poultry and fish, if a person is taking 90 gram of cooked meat, fish or poultry, that is equivalent to 1 serving. And nuts and legume and pulses and all seeds, the 1 serving would be half cup cooked lentils or 45 grams of nuts. And fat and oil, 1 teaspoon oil is equivalent to 1 serving or margarine or 1 tablespoon of low fat dressing. All these things, they are serving size of each and every food group. And when we talk about sweet, one serving would be 1 tablespoon of sugar or jam. So accordingly, when the calories they are increased, these grains and vegetable and dairy, meat, and all these items, they will be increased proportionately. Diet and feeding pattern of a hypertensive is similar to what a normal diet pattern is. So it is just normal, healthy, balanced diet. The major modification is of salt or sodium. So since the person may find food little bland because salt is an acquired taste, so a person can be suggested to use a variety of condiments and flavoring agents to enhance the palatability of the diet. For that, a person can choose lemon, vinegar, tamarind extract can be added, herbs, spices, onion, garlic. All of these things they will actually help in making the food tasty. And along with that, potassium intake, we have already studied that good potassium intake, it will be beneficial for a hypertensive person. So if a person is taking any hypertensive drugs or he's on diuretics, it is important that he takes good amount of potassium through the diet also. So it can be achieved with the help of potatoes, squashes, banana, apricot, legumes. All these are good sources of potassium. High calcium and magnesium foods, they can be taken by including a variety of cereals, grains, green leafy vegetables, low fat dairy, and nuts and oil seeds. Fiber intake of both soluble and insoluble fiber, it should be increased. And fluid restriction is only when there is kidney insufficiency or the edema is present. So there are certain habits which a person can modify, because we have seen what are the various risk factors associated with the hypertension. So what are the habits which a person can change? So the first and foremost important factor is smoking. As we know, smoking causes an immediate increase in the blood pressure and heart rate that persists for more than 15 minutes after one cigarette. So the smoking cessation, it will actually reduce overall cardiovascular risk, including the risk of coronary heart disease and stroke when it compared with the continued smoking. So a patient with coronary heart disease, smoking cessation is associated with 36% reduction in the risk of all cause mortality. So it is very important that a person has an awareness about the various sources of salt, and he is able to reduce table salt. He is able to choose the food wisely, and along with that he is able to decode various food labels. He is able to manage the addictions, which could be alcohol or it could be smoking, as we have seen in the previous slide. Then how to decode food labels? The salt could be hidden in many of the packaged food items. So it's important that a person understands how much of sodium is there in one packet of Maggi. If you read the label, then you will come to know it is more than 1000 milligrams in one packet. So let us discuss certain useful tips during hypertension. Sodium intake should be restricted to 1500 to 2000 milligram, that we have already seen in the calculation in the last lecture. That is equivalent to approximately 1 teaspoon of salt. And use of non-food items which contain sodium, such as antacids, chewing tobacco, and drugs, they should be identified so that a person knows how much sodium is going inside his body. The person should be provided with a list of high sodium foods, and it is advised on minimizing the sodium intake from such sources. Use of salt substitute, that should be ascertained, and especially in case of renal diseases when it is contraindicated. People, they go for low sodium salt, and such salts, they are higher in potassium. So adequate potassium consumption, it is needed to control the blood pressure. Adequate calcium intake is needed for good control of blood pressure. Magnesium intake can be assessed, and the supplements, they can be considered if the person is not able to take them in his normal diet. Coming to alcohol, moderate intake, it has no effect. But heavy drinkers, they need to be advised to abstain. And it is good if the person is able to stick to one drink. What is one drink? That is equivalent to 150 ml of wine, 360 ml of beer, or 45 ml of 80 proof liquor. Along with diet and lifestyle changes, regular physical activity, that should be encouraged. Person can go for aerobic activity, which is moderate to vigorous intensity activity, 3-4 times a week, and each session should be of 40 minutes. And if the person is able to follow this routine, it is effective in reducing both systolic blood pressure and diastolic blood pressure. Let us talk about stress management. As we know, stress is an important determinant of hypertension. So a person can go for yoga, he can go for meditation, he can take the help of physical activity, and he can actually go for organizing his life nicely. So let's summarize what we have studied about hypertension. We have studied that hypertension, it is a public health challenge worldwide because of its high frequency and associated risk of cardiovascular diseases and kidney disease. It is sustained elevated arterial blood pressure when measured indirectly by an inflatable cuff and pressure manometer, that is sphygmomanometer. And 90% of the person, they are suffering from primary hypertension, and rest, they have secondary hypertension. The exact cause of hypertension, it is not known, but these conditions which are highly associated with hypertension are certain risk factors such as genetics, then advancing age, gender, dietary habits, lifestyle, then obesity, along with certain diseases. They can actually cause hypertension. Many a times hypertension does not have any symptoms. That is why it is known as silent killer also. But common symptoms associated with hypertension would be headache, dizziness, or some of persons, they would feel blurred vision. There could be pain in the chest. They would feel palpitations, or there could be nosebleeds also. Hypertension, it can be damaging due to two effects on the body. First is it will increase the workload on the heart, and secondly, it has effect on the arteries, and it can actually affect the arteries of various parts of the body, such as it would affect heart, it would affect brain, kidney, eyes, and it can actually very badly affect peripheral arteries also. So the management of hypertension would involve dietary changes, change in habits, and lifestyle. And we studied that excess calories through fat and carbohydrate, that should be reduced so that the weight is maintained. So normal protein contributing 15 to 20% of the total energy needs, it is recommended. For fats, PUFA-rich diet is preferred, and animal fat and hydrogenated fat must be avoided because these people, they are more prone to cardiovascular diseases. And 60 to 65% calories, they should come from complex carbohydrates. We also studied that adequate calcium, potassium, and magnesium intake, it is an essential part of hypertension treatment. And then we studied that the sodium restriction Along with the weight reduction, it is effective in controlling mild to moderate hypertension, in which we allow 1 to 2 grams of sodium in a day. And depending upon the severity of the hypertension, different levels of sodium intake they can be recommended. And then we studied about sodium salt conversion to know how many milligrams of sodium are equivalent to how many milligrams of salt. Fiber intake of both soluble and insoluble fiber sources is important, and it should be increased in the diet of a hypertensive person where he can use a variety of food items. And fluid restriction is needed only when there is kidney insufficiency or there is water retention, that is edema, which is present in them. In the last part of our presentation, we studied about DASH diet, that is dietary approaches to stop hypertension. And we studied that in this diet, the major recommendation is to go for low-fat dairy, fruits and vegetables. And a person has to reduce the intake of fats, sweets and red meat. And along with that, for any hypertensive person, it is important to control certain habits. And he has to go for good eating practices and good habits are to be inculcated. So cessation of smoking, taking alcohol in moderation, going for some kind of aerobic activity or any physical activity, along with weight reduction, they are actually helpful in managing and controlling. Along with that, it can actually help us in preventing the hypertension. And lastly, we discussed that stress management through yoga, meditation, physical activity, or organizing your life accordingly can be actually beneficial in controlling hypertension. So it is good if a person is a positive thinker, he's eating better, he's exercising often, he will feel good and his hypertension level will go down. May 17th is celebrated as World Hypertension Day every year. So let's take care of our heart.